Now, there's other reasons that a person might want to consider supplementing with N-acetylcysteine. Again, depending on where you live, maybe some of you are watching from countries where NAC is considered a drug. That's where, you can talk to your doctor about a prescription. But several different things here. So one would be an acetaminophen overdose. This is why the FDA has approved NAC as a drug. It is to treat acetaminophen. This is, Tylenol overdose. How many of you pop Tylenol on a regular basis? As a matter of fact, one of the drugs that we know, or one of the things that we know depletes glutathione and cysteine, N-acetylcysteine, is regular use of Tylenol. Not even necessarily overdosing. It's because the liver has to process that drug, and in order to process it, it's using cysteine to do that. We also know that cold and flus, upper respiratory infections, that cysteine and acetylcysteine, there are a number of human trials that have shown benefits in that regard. We also see it with bronchitis and asthma. Again, there are a lot of reasons why a person might have asthma or might have bronchitis. Smoking inhalation, gluten exposure, other food allergies, environmental allergens, etc. But NAC can be used as a mucolytic, and this is where it helps to alleviate some of the breathing pressure. And then we also have research studies on PCOS, polycystic ovarian syndrome. You remember I showed you a moment ago how NAC helps with insulin sensitivity. And this is one of the reasons why it helps PCOS, because in essence, PCOS is a form of diabetes. Basically, it's diabetes of the ovaries. And if your doctor never told you that, ladies, and you're being treated for infertility, you might want to look at looking at the gluten-free diet and looking at a lower carbohydrate, higher fat, closer to keto type diet to overcome that blood sugar problem. We see this a lot. There are a lot of times where women are infertile because of PCOS, and when they dial their diet in, so a diet change alleviates the PCOS because, again, it's a form of diabetes. We see that women with bacterial vaginosis, there have been some studies that show that when women have a history of bacterial vaginosis, and then they're about to give or deliver birth, there's some problems with the delivery. And so in these women, OB-GYN doctors and some research studies are giving these women N-acetylcysteine to offset the complications of delivery. We also see the same thing in women with a history of preterm births. If you've had, maybe ladies, if you've had 2 children and you're pregnant, you're about to have a third, and both of your deliveries were preterm, there's now evidence showing that using N-acetylcysteine during pregnancy actually helps diminish the risks associated with that preterm delivery. We see it being used in ulcerative colitis. I'll show you some research on that in a moment, as well as liver cancer and exercise muscle performance. And then there's also new evidence coming out on the nervous system and how N-acetylcysteine helps to block the damage that can be done, the free radical damage that can be done to nerve cells in patients with Alzheimer's or Parkinson's. And then there's also research on male fertility problems. As a matter of fact, let's dive into some of this research. Shrink that down, and we'll pull these studies up for you. Okay, so this first one here, N-acetylcysteine supplementation on sperm quality, chromatin integrity, and level of oxidative stress in infertile men, as I was just talking about, right? And so in this study, in this human trial, right, so we had 50 infertile men. They received 600 milligrams a day of NAC. So this is just for a 3-month stint. And what they found as an outcome was after NAC treatment, these patients' sperm count and their motility increased significantly. So sperm count, that's obvious, the quantity of sperm these men are making. But motility has to do with how well their sperm are capable of swimming upstream. So again, if a man has adequate sperm count but has poor motility, it reduces the chances of impregnating his wife. So again, NAC treatment significantly improved both of those parameters. So conclusion here, NAC oral supplementation can improve sperm parameters and oxidative antioxidant status in infertile males. So I say that because so much of the time, women are blamed on the infertility issues, and it's not all the time. If you've seeing an infertility doctor and you have a good one, he's going to look at both the husband and the wife and rule out the different variable potentials. But a lot of times women get blamed, but it's not always the woman that's responsible for the infertility issue. In this one, we didn't talk about yet, but this is a meta review on major clinical trials that were done using N-acetylcysteine as a treatment to reduce or to improve outcomes in people trying to overcome addiction. And so there's a lot of data on NAC in people that have drug addictions, whether those drugs be pharmaceuticals that were prescribed or also in many cases drugs that are illegal types of drugs like cocaine. But we've seen studies on N-acetylcysteine being effective for alcohol addiction, for marijuana addiction, for methamphetamine addiction, as well as pain medication addictions. And so this is just, again, a meta-analysis of multiple trials. And so a total of 16 trials here were analyzed, and some of the outcome conclusions. NAC provides certain noticeable benefits in attenuating substance craving and might help alleviate depressive symptoms and withdrawal syndrome, because a lot of the reason why people are addicted is they try to get off and then the withdrawals keep bringing them back. So NAC being very, very beneficial in that regard. So if you're struggling or battling drug addiction or illicit substance addiction, you might also consider looking into NAC as a tool to help you overcome those problems. Now, here was another review paper, and so this one was reviewing multiple different mechanisms, but we'll just go through a few of these. Liver cancer. So in this, you can see here, NAC is an enhancer of glutathione biosynthesis. Remember, that's the antioxidant. Is one of the frequently used antioxidant drugs for treatment of liver disorders. Cell culture and animal models have shown that NAC can preserve normal cells against the toxicity of radiation therapy, radiotherapy, and chemotherapy. Administration of NAC may play a role in the treatment of some forms of cancer, while induced damages in DNA can be completely blocked by NAC. So it protects your DNA and it protects your liver. Key things, key aspects, especially, again, when that's where the cancer is. Also protects you from chemo and radiative damage. Ulcerative colitis. You can see here, NAC may not only protect against the direct detrimental impacts of oxidants, but also advantageously modify inflammation events in colitis. So if you're dealing with an inflammatory bowel disease like colitis, there are other forms of inflammatory bowel disease as well, you might consider NAC. You see the beneficial influences of NAC were related to the changes, including, number one, softened colonic injury or less injury. Number two, decreased oxidative stress. And number three, lowered cell apoptosis. In other words, preserving the integrity and the lifespan of cells in the colon. And then increased recovery of the injured colon. And then number five, increased formation of tight junctions. Remember tight junctions? I'm sure you probably heard that somewhere. If you've ever heard that term, leaky gut. What prevents leaky gut is when you have intact, tight junctions. If those are not intact, then your poop leaks into your bloodstream and creates all kinds of nefarious systemic inflammation that can become very, very problematic. We don't want leaky gut. It's a driver of autoimmune disease. You can also see in this review, we talked about this earlier, but in addition, acetaminophen toxicity is a common cause of drug-induced liver damage in children and adults. NAC has been used for several decades, and it has been proven as a counter-poison choice in treating acetaminophen-induced hepatotoxicity. So again, all great functions to consider talking to your doctor about with NAC. Let's talk about a few more. There's a few more studies I pulled for you today on other beneficial effects of NAC. And this one's in exercise performance. So some of you may be looking to incorporate exercise back into your life. I know a lot of you listening to this are struggling maybe historically with years of autoimmune disease or years of chronic fatigue or illness or muscle pains and aches, and you've tried exercising, but you don't tolerate exercise. Well, this is for you. This is also for those of you who are athletes and trying to improve or enhance your performance. As a potential possibility, consider NAC. You see here, they investigated whether N-acetylcysteine supplementation would enhance exercise performance by increasing glutathione concentrations and by reducing oxidative stress And they did this study on individuals who had low levels of glutathione. So that was the indicator here is if somebody had low resting levels of glutathione, NAC was tremendously beneficial. Now, if they had normal levels of glutathione, taking more NAC didn't do much. So if you're considering this for exercise, you might also consider getting your levels of glutathione tested. This is a simple test that can be performed by nutritionally trained doctors. Now you can see here the individuals were supplemented with NAC. The dosing structure here was 2 times 600 milligrams twice a day. So for 30 days. So this basically, it's 2,400 milligrams a day in divided doses, so 1,200 times 2, right? And this was done for 30 days. So this is just done for a month. And so they found the low glutathione group improved after NAC supplementation in their VO2 max time trial. You see down here, individuals with low glutathione levels were linked with decreased physical performance, increased oxidative stress, and impaired redox metabolism of erythrocytes, meaning their blood vessels having low levels of glutathione, it impaired their ability to exercise. It impaired their delivery of oxygen. Remember, exercise is oxygen dependent, at least aggressive exercise. So NAC supplementation restored both performance and redox homeostasis. Again, if your glutathione levels are low and you're trying to exercise, NAC can enhance your performance and as well your recovery. So one more reason to consider using it. Let's talk about one more research study here. And this is on NAC's performance for the skin. So you can see here, this is a review, a major review of multiple studies published in the Journal of Clinical and Aesthetic Dermatology. This is, again, something you can find at the National Institute of Health. We've got here, in their results, they found in their review of multiple clinical studies in humans that acne vulgaris, or acne, was improved as a result of using NAC. So the investigators observed significant superiority results among patients treated with NAC compared with the placebo group in reduction of comedone counts, which is acne, suggesting NAC might be an effective treatment option for mild to moderate acne vulgaris. Now, it's important to note this study was done using topical cream NAC. So this was not done using an oral supplement. This was actually done using a topical application. So if you're struggling with acne, one of the more common treatments today that doctors give for acne is a synthetic form of vitamin A called Accutane. In my opinion, a very, very high side effect profile type medication that, if I had a daughter with acne, there's no way I would want to put her on it. This might be a better option. Talk to your dermatologist whether or not NAC is right for your acne. Okay,